Alright, so what's health and well-being? Health and well-being is more complicated, it's more difficult to define. You could probably tell that from the kind of nebulous name that it's got, But it's extremely important. It's an area on which there is a great deal more attention in schools now than there ever was, even when I was at school. And that is unequivocally a good thing. It's also an area that is seen as the responsibility of all. It's not just down to, say, guidance teachers to be concerned with the health and well-being of young people. It's everyone's responsibility. But what does it mean? How do you define a term like that? There isn't any single one definition. There are many definitions available to you online if you wish, but they all kind of get at the same sorts of idea, basically. So maybe it's more useful, instead of trying to get focused on a specific definition of a very big broad term, maybe to look instead at the way in which health and wellbeing is broken down within the curriculum in Scotland to understand what it is that we're talking about. So it's broken into a number of specific areas, which I'm just going to run through with you. The first one is mental, emotional, social and physical well-being. That's about understanding and expressing feelings, contributing to communities and to groups, and identifying risks, physically, socially, mentally and emotionally as well. After that comes a section called Planning for Choices and Changes. So that's understanding themselves, understanding their own development, their own learning. Not just understanding that choices are and need to be made in life, but making them ambitious about those choices and about their own future, and connecting all of that to the kind of skills in which they'll see in the adult world, the workplace, or whatever it is they choose to go into. Next up, you've got physical education, physical activity and sport. This is probably the closest thing to what would have been a health and well-being concern when I was at school, making them play some football for a couple of hours. It is about participation in sports, but it's also about things like the importance of practice and the approach to planning, that sort of thing. It incorporates cooperation with others. It actually even, and I've always thought this is interesting and a good thing, it includes at least a desire to ensure that young people are enjoying their participation in sport, which is an important distinction, I think, to draw between just forcing them through all the time and ticking some boxes. The next section is called Food and Health, looks at nutrition, hygiene, things you'd expect, but gets into as well things like advertising around food, helping young people understand how different approaches to advertising have different impacts on people and then on their health and on their well-being afterwards. You have, as you would expect, a section on substance misuse. Again, the kind of thing that maybe a bunch of us did get in school, but maybe not in quite a health and well-being kind of context, more a scare them context. But they're still going to cover substance misuse. We're going to look at, drugs, including alcohol. They look at, the personal and social impacts of substance misuse, national and international factors, impacts in the local area, things like that. And you have a section on relationships, sexual health, and parenthood. So it gets into things like, friendship and relationships and power dynamics and interesting things there. It gets into, how young people can identify and access the support and services that they might need, and also, obviously, deals with, right across the curriculum, the idea of appropriate sexual behaviour, which obviously for young kids is about teaching them to identify inappropriate behaviour towards them, and as kids are getting older it's about teaching them to identify and manage the risks involved in their sort of developing sexual identities and sexual behaviour. The reason this all matters so much, sometimes people kind of talk about this stuff as if it's like, a nice wee add-on or something like that, but it's not as important as reading and writing and adding up and stuff like that. But the problem is that a lack of safety and security and confidence, which is what we're talking about with health and well-being. If there's an absence of health and well-being, there's going to be that absence of safety, security and confidence, and all that actually has a really serious negative impact on learning. So there's a direct educational imperative, if you like, but that stuff also has a massive impact and does huge harm to people. And the thing about education is that it's not really about pouring things into kids' heads. It's meant to be about developing human beings as part of a broader society. And if you accept that, then actually health and well-being, it's not difficult to see why it's so important. However, I do think it's important to caveat this by saying there's a lot of criticism in this area when it comes to Scottish curriculum, the Scottish approach to it. It is the responsibility of all. Everyone is supposed to be a teacher of well-being. Everyone is responsible for ensuring that amongst young people. And yes, it's got a specific part of the documents. It comes really early on, all the right stuff and everything. And yet, it still kind of feels in many cases like it's a secondary concern at best. Like it isn't really fully approached or presented, or that teachers are never given the resources and the time to deal with health and well-being with the importance that they are also being told that they should give it. And it's probably worth noting here that, we've had, what are we at now? It's 8 years of policies in terms of improving Scottish education that are all about closing attainment gaps. And they've basically been policies about chasing what have turned out to be very, very minimal improvements, if you're lucky, in literacy and in numeracy. But is it possible that over the last 8 years, while we've talked a lot in health and well-being, we've actually failed? Because curricular documents are one thing, that's easy, right? But this is a country where we talked about substance misuse. The level of drug deaths in this country is a genuine national scandal. The waiting times for young people's mental health services absolutely should be a national scandal. Even something down to being as simple as, we have an extremely rigid examination system, which doesn't allow for a lot of flexibility, despite the fact that the curriculum itself seems to be set up to identify lots of factors that can affect people. So it's easy to say that health and well-being is just as important as literacy. It matters just as much as numeracy. We care just as much about that as we do about the exam results and all the data. But the reality is that it's much, much, much more difficult to actually make all of that come true in schools.